Claire, I want to step back again. You mentioned that with the athletes and the low grade inflammation they might have, that it's possible that they don't absorb the iron. Is there any advice that you can think of how do we overcome this?
So I think the first thing is that, it's back to screening. Every athlete must know their ferritin. So, and because there are two ways to look at this thing. So the one is, yes, I probably need to take a supplement. And then we'll talk about when to take my supplement. And then the second is a supplement ever even going to work for me? Am I not the type of athlete that actually needs to get intravenous iron? And is this not a place that we need to start exploring more, is who are the athletes that no amount of supplements is ever going to work for? So we need to start by knowing our ferritin. And I want to tell you, at my last iron talk, one of my friends, he's also a doctor, and I'm not going to say what specialty is because he's from a small specialty, and he listened with intent and he gave me a hard time. And he went home and the next day checked his ferritin and it was 7. And he is a high performance athlete. So don't think that just because you're a doctor that you are exempt from getting iron deficiency. And importantly, don't think that because you are a man that you are exempt from getting iron deficiency. And don't think because you're a healthy man that you are exempt. It follows athletes like a shadow. Okay, so we need to screen. Then we need to take, obviously, a proper diet. But I think that that's a talk all by itself. When do I take my supplement and which supplements should I take? So the first is maybe the easier question to answer is when to take my supplement. So there's data in athletes to show that actually, straight after, which is counterintuitive, but that's what the data says. So straight after my exercise, that's when I should be taking my whatever supplement it is that I chose to take. So not in the evening, not before I train. So go and train, come home, have your orange juice and drink whatever iron it is that you have chosen for yourself or that your doctor has advised you to take. There are different iron formulations on the market, and I think that's a talk that would take more than 2 hours to go through. But I just want to warn you that in general, we advise against enteric-coated iron tablets. They cost a whole lot more, and there's zero benefit from taking an enteric-coated iron because you just sort of miss the whole place where the iron is absorbed. Side effects of oral iron is a problem for some people, and that is something where I think that we need to listen to our patients and listen to our bodies. And if you do feel nauseous, which is the most common complication of oral iron, I think that then you need to see, well, can I tolerate it or can I change to maybe another iron formulation that doesn't cause nausea as much? And then, and if I can't tolerate that either, then you're definitely moving into the realm of somebody who needs to get parenteral iron or intravenous iron. I hope I answered the question. It felt a bit convoluted.
Yeah, no, you have. And I think we've also ended up, we now run an iron infusion clinic in the northern suburbs of Cape Town because we realized that supplementation is quite an issue, and our medical aides in South Africa will then, if you've been on an iron oral supplement for 3 months and you're not getting the levels correct, that's the next thing the athletes then need to go, and that's not okay to leave it there. You need to then tell your doctor to motivate for IV iron so that you can get the iron in the vein and bypass this gut that's causing you problems or not absorbing correctly.
And the only way we can know that is by actually testing. So we go back again to you need to know your numbers.
Mm-hmm. So that can't be overstated. And I think that we mustn't ignore the inflammation, and not keep blaming ourselves. Well, maybe I didn't take my iron properly. Maybe I should have taken it every other day. But we must acknowledge that even in a super fit athlete, there is a degree of inflammation that makes it difficult for oral iron to always work. And we should have a low threshold. I'm talking to the clinicians now, but we should have a low threshold to turn a patient over onto parenteral iron. there was actually a study that showed that but this is now in the context of being anemic, but that if you are anemic and your oral iron doesn't work within 4 weeks, it's unlikely ever going to work. So I think that we need to start challenging the funders as well. Why should somebody struggle for 3 months on an oral iron if it hasn't, it's not going to work? But that's also a talk for another day. But yeah.